Hello and welcome to the Wachusett Area Chamber of Commerce Business Showcase. I'm Jen Stanovich and I will be your host as we learn more about the many businesses located in the Wachusett area. Today our focus is on Oriol Healthcare, a family-owned and operated company that provides care through nursing centers, therapy, fitness, and home care services. This continuum of care is called Oriol 360. And here to explain more is Debbie Ossipoff, the Director of Marketing and Community Relations. Welcome, Debbie. So Oriol Healthcare has been in business for more than 50 years, which is very impressive in itself. But talk about the family tradition that's involved there.
Oh, Oriol has been a family-owned business for going on 60 years now. It was started by the current owner's father, Gene Oriol, and his twin sons, Bob and David, are the current owners and president, vice president of the company. They also have continued on the tradition by the third generation coming on, and Nathan Oriol is also with the company. And Bob and Dave's sister, Christine, is also a nurse with our company, the home health company. So they've kept it in the family. They've kept it a family-owned business. They have not gone the way of chains as many other healthcare facilities have.
Right.
And we also see a lot of our staff are generations of families where we had nurses or maintenance people or et cetera, and their children have come to work. So it is a very nice family-centered environment.
And that speaks a lot to the quality of the business and the integrity of the business to have people long-term like that. That's great.
It sure does. I think it's one of the many reasons that I've been there 24 years. They like to watch people grow and be part of the family and become that culture that has been their family. And it's very warm and inviting, and we carry that on to the people that we care for.
Sure. And speaking of those people, so when it started 60 years ago, began with Holden Rehab, right, or Holden Nursing Home at the time.
Right, Holden Nursing Home and West Boylston Nursing Home, which both became Holden Nursing Home and Oakdale Nursing Home. And not until a few years back, since I've been there anyways, did we evolve into having Oriol Therapy Services, our therapy company, and Oriol Home Health, which is our most recent company venture. And we also have a little-known Oriol Financial Services, which helps the community members who need to file mass health applications or maybe having some struggles with their health insurances. And we also have a nonprofit, the Oriol Foundation, which brings wellness into the community. So it's certainly not your grandmother's nursing home anymore.
Right.
It's not just about the long-term care.
Well, and it certainly shows how you've reacted to whatever the needs are. I mean, to bring in the fitness and the home health care and all that just evolved organically, right? Because it was needed at the time. And
I believe so. Bob and Dave are very in tune with what the community needs are. They do reach out to the community to see what the needs are. They try to stay up with the trend of aging in place and people wanting to, people are living longer and staying more active. They're working later in years in their life, and the hospitals aren't keeping them very long, we all know, if they're recovering from something. So this gives us an option to help take care of them in different stages of recovery or different stages of need. Not everyone needs just a place to go for long-term care for end of life. A lot of people do need that short-term rehab when they come out of the hospital and or nursing and therapies at home once they go home or on an outpatient basis.
Sure. And you do offer outpatient physical therapy.
We do, not only physical therapy, but occupational therapy and speech therapy. And we serve all ages, not just the senior population. So again, that was an expansion for us, that even though our outpatient clinic is located within Holden Rehab and Skilled Nursing, there is a separate entrance. They have their separate changing facilities, a gym, and a little kitchenette and an apartment so people can do their activities of daily living and come in on an outpatient basis.
And it's a beautiful facility. And
It
being
is.
so centrally located for area residents to be able to just stop in
It
for
is.
therapy, it's a great benefit.
And I think that's a big plus for people in this community is saving them that trip to Worcester or Framingham or Boston, where they can get quality services right in Holden without having to go too far.
Absolutely. So the Oriol 360.
Yes.
This is a whole continuum of care that, like we said, began with Holden Rehabilitation and Skilled Nursing at Oakdale, and now with all of the services you offer,
Right.
you've bundled that. Talk about that.
Yes, we call it Oriol 360. It's what our continuum of care is represented by. We try to have a holistic approach to people and take care of them in many different ways, and that's where the 360 comes from. I'm out in the community quite a bit trying to provide wellness to people so that they're aware of us when they need us. We obviously have short-term rehab, so people who are recovering from some sort of medical incident can come in for that short-term stay before going home. Some people have a short-term stay before going to a hospital where they're getting prepared and strengthening before going in for a procedure. And we have the therapy clinic where we do the physical therapy, occupational therapy, and speech therapies that serves not only the inpatient population that is staying with us, but serves the outpatients. And we have patients that we call our 360 patients, the people that have, for example, come in after a hip replacement or a cardiac surgery. They're with us for a few days to a week for some rehabilitation, and they're having therapy services. When they're ready to discharge home, our Oriol Home Health can follow them home. They already know us. They're being treated oftentimes by the same clinicians they had in short-term rehab. So they're familiar. Mm-hmm. When somebody's coming into their home, they know these people. And our clinicians know them already. So they already have that established relationship. And once the patient is better at home and ready to go back out, they can come back to us for outpatient. And it's become a nice circle of care where you're staying within the same group of people caring for you. So we already know you. We've formed that relationship, and you're not starting all over again with different companies.
Right.
So it's really become a wonderful way to see people all the way through their recoveries and continue on even if they aren't needing any more skilled nursing care or skilled therapies. We have Oriol at Home, which does private services, companionship, and going on errands, and just sitting and playing cards with somebody. There's a lot of people that are a little socially isolated, especially after COVID. And we address that as well, because we don't want people just being home and not having any social interaction.
Right.
So we get to see people in all different stages, and it's really enjoyable.
Well, think how comforting that is for them.
I think so. I do think, I've seen people say, and we've received testimonials from people that say that was a big part of them getting better, because they knew who they were working with, and they always knew what was ahead of them, because we could lay out this whole program for them and their recovery. And they didn't have to, say, change to another company or other nurses or other therapists as they got better. Their environment just changed, but not their care.
You have to think that, without that stress, that then they focus on themselves and it helps them to get better. It just makes sense.
Exactly.
I think it's terrific. And the home health care aspect, I mean, you do more than providing them services. You're helping the caregivers too, which is another really important aspect of it, isn't it?
Yes, it really is. And we encourage people, if possible and supported by their physician, to ask for home services, no matter where they're going to or where they're coming from. A lot of people think, oh, I'll be fine. But they're not accustomed to being home with an illness or an injury that they're recovering from. So it's always good to have eyes on somebody. I had used the services myself after having a surgery And had I not had the nurses come in, we wouldn't have caught a problem I had had with my surgery. So
Right.
it's always good to have that extra set of eyes, even if it's just for a few visits. And you just have to ask your physician. You know, I'd feel more comfortable if I went home and somebody came home to see me.
Sure.
And it does help the extended family know that there's someone with eyes on them to help.
Right. Well, and knowing how the Oriol brothers are very community conscious, which is great. I mean, they're great supporters of the chamber, and they're out there in the community all the time. And your role plays a part in that, because you're one of the people who's out there making
That's
those
me.
connections, right?
Yes.
What do you do for the organization?
So it's evolved, as you know. I've known you over the last 20 years. I came on as the Director of Community Relations, and that evolved. My job was really to make the community aware of what Oriol Healthcare is and what they provide, because most people were only familiar with Holden Nursing Home and Oakdale Nursing Home, and there was so much more to it. So as they grew, I started going out into the community more and more to try to explain to people what it is that we offer and what's available to them. And it grew into meeting community needs for knowledge. There's so many people out there that want to be informed, and they didn't know what steps to take. So we realized we have this wonderful team of clinicians and experienced people that could provide this information to the community. So I started taking this out to the community, to assisted livings and to senior centers and different venues, to educate people on how to stay well in the community. And I've personally learned so much from what I've learned and what I teach on balance and caregiving and dementia, and even putting papers in place that you need to have on advanced directives and healthcare planning. And it's been wonderful to connect with the community. It's my favorite part of the job. And I'm so glad that now I can do that again, that COVID is finally not at the stage that it was. I still take precaution, but for the most part, I'm able to start little at a time taking
Sure.
programs back out into the community. And Caregivers Group is one of them that has been very successful and very dear to my heart.
Oh, well, it's very important what you do, and education is just so key, right? You're helping
is.
people in that way too, so
It is.
it's a beautiful thing. And the foundation, and the Oriole Foundation, they also offer scholarships too,
Yes,
right?
they do. We have 2 scholarships each year. The foundation was started by Bob and Dave personally, so that we would be able to give back to the Wachusett community in the form of wellness. So we are always looking for needs in the community, and people are more than welcome to approach us if they have a wellness need in the community. So we started this as a way to do that, and also help encourage young people that want to go into a healthcare career with a scholarship. So we have 2 that are memorial scholarships to Eugene Oriol, and one is for a graduating senior in the Wachusett or West Boylston district. The other is for a team member, so someone that is employed by Oriol that wants to advance their career. Say it's quite often we have dietary employees or activity employees that really end up wanting to be a CNA or a nurse. So they're entitled to apply.
And that too is all part of giving back.
It sure is.
So if
Yeah.
someone wanted to learn more about the services that you offer and the programs that are available to them, where would they go?
The best place to start would be our website, so oriolhealthcare.com.
Okay.
We have tabs on each of our different facilities. They can take a virtual tour, so even from across the country, if it's family looking in to see what's available for their local parents or family, they have virtual tours on there. We keep our calendar posted with the events that we're doing in the community. We have information on Oriol therapy services, and we also have information on Oriol home health and at home.
Okay.
The scholarship applications are also on there. So it's a good place to start. We also do have a presence on social media. We have a Facebook page. People are welcome to follow. And we're also on Instagram, Twitter.
You're out there.
Yeah, we're out there, and I'm
Right.
out there as well. So, and
Well, it seems to me that no matter where you or your loved ones fall in the continuum of care, that Oriole Healthcare is there to help.
we hope to be.
There you go.
We are. Thank
Debbie,
you.
thank you. Thanks for joining us today. I appreciate it. That wraps up this edition of the Wachusett Area Chamber of Commerce Business Showcase. Again, I'd like to thank Debbie Osipov with Oriole Healthcare for joining us. And join us next time as we learn more about local businesses in the Wachusett area. I'm Jen Stanovich. Thanks for joining us.